All right, so let's start with the big story that we are tracking on WION at this hour. It is a race against time for the scientists to try and understand the implications of what this new mutant variant, called the Omicron variant of the coronavirus, actually means. Remember, ever since this virus, in fact, was detected in South Africa, it has set off alarm bells around the world. In an exclusive interview, WION spoke to the chairperson of the South African Medical Association, Angelique Coetzee, who has been treating the new cases in her country. Remember, South Africa was the first one to identify and also alert the rest of the world that there is a new mutant strain of the coronavirus that in fact has come forth. And the doctor said that at this point of time there is no need for people to panic, since scientists are still trying to understand the characteristics of this new mutant variant of the coronavirus, and that travel bans at this point of time are completely an unwarranted action. He's also warned that such reactions could in fact hinder other nations in the future from coming forth and reporting on any new mutant variants of the virus. Listen in.
What do we know about this virus Omicron so far?
So what we know this far is that it is most probably fast spreading. We saw our infectivity rate went up quite significantly from last week. And then we also know that again, so far, it's mostly mild diseases. I haven't seen the hospital admission rate today. I still presume, looking at the cases that we have seen, it's still mild, it's still young people that we are predominantly seeing, young people less than 40 years of age. We do see people who's been vaccinated, but they're not severely ill.
You and your team, you're one of the first people to, to have recorded and witnessed this, possibly the first case of Omicron in the country. So do you think there is any reason for panic, like it's happening in other parts of the world with, putting travel bans in South Africa? And do you think that should be done, Doctor?
We're still trying to figure out what is happening with this virus. What is the clinical pictures? What is the background? What is the RR rate? What is all the immune escapes that might be possible? We're still trying to figure that out. We were just open and say, look, listen, this is what we see from the scientists and alerting the world, as we have done every time before. And then from family practitioner or primary healthcare, we are trying to say, this is the symptoms that we are seeing. It might change going forward. Our scientists also said they're not sure about, all the questions and what the virus will do. They're still working on that. All of a sudden, when all this information got out there, we were slammed with travel bans. And that going forward, that would make certain countries think twice before they're going to share their very important news or clinical findings or scientific findings with the world.
WION is now available in your country. Download the app now and get all the news on the move.